Welcome. Today we are looking at concept of health and disease chapter. In this, the most important question for you is modes of intervention. First of all, if they ask you modes of intervention, please define it. It is any attempt to intervene or interrupt. So you're going to intervene or interrupt. What are you going to intervene or interrupt? You're going to interrupt the usual sequence of development of disease. And how do you do this? So you're going to do it in these ways. These are the modes: health promotion, specific protection, early diagnosis and treatment, disability limitation, rehabilitation. Fine. These are the 5 things you will do. What are the 5 things you will do? Health promotion, specific protection, disability, early diagnosis and treatment, disability limitation, and the last one is rehabilitation. So let us see how you can do this. Health promotion, even before the disease sets in. Specific protection is like immunization. Even in case finally the disease comes, then you're going to do an early diagnosis and treatment. If the disease has hit and the person is going in disability, try to limit the disability. And finally you have rehabilitation, which is basically going to be training of the individual or retraining of the individual, so that they get the highest possibility of functional ability. Fine. So if they ask you modes of intervention question, if you write the definition and these 5 things, you almost have half the marks. Okay. Anyways, you will explain each. Now let us look at health promotion. Under health promotion, so what you have to explain under health promotion, first of all, what are the objectives of it? Okay, you're going to enable people to improve health. You're not directing this at any specific disease. You're strengthening the hosts. And under this, what is there? See, you will have to also explain here something called as the Ottawa Charter of Health Promotion. Ottawa Charter for Health Promotion. Now, explain this also. So, I will come to this OCHP, Ottawa Charter for Health Promotion. Now, basically, when it comes to health promotion, you have to explain what you're doing here. You're enabling people to improve health, explain to them how to get health, right? You can write all those things, and then you can say it is not directed at specific disease, because specific disease comes in the next point. What is the next point? Specific protection, correct? So, we'll come to that in the specific protection. But here, it is not related to any specific disease. And you're strengthening the host, and you're also making the environment such a way that it cannot harbor the organisms, the agents. Now, here you will have to explain Ottawa Charter for Health Promotion, OCHP. Now, 5 key action areas and the strategies of Ottawa Charter Health Promotion. So, you can look here for the 5 key action areas of health promotion. Here they are. You should have a health policy. You should have a supportive environment for health. You'll have to strengthen community action for health. You'll develop skills and reorient health services. So these are the 5 things that you can focus on if you want to write Ottawa Charter. Okay, there's a diagram also that goes with it. Let me show you. So this is the diagram of the Ottawa Charter of Health Promotion. Here you have public health policy, supportive environment, skill development, community action, reorient health services. These are the 5 key action areas, and the strategies are these: enable, mediate, advocate. Now, under health promotion, there are 4 points you have to write. Whatever we wrote now is only introduction. 4 points that come under health promotion are health education, environmental modifications, nutritional intervention, and lifestyle and behavioral changes. See, understand this. This is something that is happening before disease comes at all. This is something like a primordial or a primary prevention where there is no disease. Okay. Now, health education, you're going to modify the environment, you're going to give nutrition, good nutrition. Lifestyle behavioral changes are going to be maintained so that the health is not affected. Okay. So, under these again you will elaborate, right? Now health education. See, these community medicine is like this. You have to remember a lot of things under the SWOT points, under the SWOT points. So let me just recap for you. We are looking at modes of intervention, right? We are looking at modes of intervention. Under that, there are 5 modes of intervention. What are the 5 modes of intervention? First one is health promotion. Then you have specific protection, early diagnosis and treatment, disability limitation and rehabilitation. Now we are in health promotion. In health promotion, you have 4 things: health education, environmental modification, nutritional intervention, and then the last one is lifestyle and behavioral changes. Now coming to health education, let me explain health education to you. I'm not going to. So health education basically is what and all you'll have to write here. This is cost effective. It's the most cost effective one. Okay, it's most cost effective, and many diseases can be prevented, and little medical intervention will be necessary if people are already taking precautions. And the target for health education will be the general public, the health providers, community leaders, decision makers, etc. Example here will be ORS powder to be given in diarrhea. So we are here, and under health promotion, which is a mode of intervention, we have seen health education. Now let us move on to environmental modifications. So this won't be much difficult for you. Environmental modification means giving clean water, sanitary latrines, control of insects, rodents, the housing. Basically all of these are non-clinical. These do not involve physicians, and they have successfully controlled many infectious diseases in Western countries. Okay, so successful model this is. Now let's move on to nutritional intervention. So nutritional intervention, everything to do with food. So you can say food, nutrition, distribution, fortification, then nutrition education, child feeding programs, right? You know, the midday meals, right? You can add all that here. Then you can talk to the improvement, you know, of vulnerable groups. You can give, like even pregnant mothers. Fine. So all this is under nutritional intervention. If you have time, you can elaborate further on these. Moving on to the last point under health promotion, you have lifestyle and behavioral changes. So here this is a responsibility of individual, community. Even physicians can take this responsibility, health workers. I'm making it up here so that you can see responsibility of individual, community, physicians, health workers. It's also the responsibility, you know, there should be some interventions on the organizational, political, social, economic interventions. Okay, on that side also it should be there. Now you should have like examples, you can say smoking, alcohol, etc. You should set some goals, and you should have a target group for this. And you can give examples here, like before movies they show smoking is injurious to health, tobacco consumption is bad, alcohol is bad, such things. Okay, so let's revise. The main heading here for us is modes of intervention. This is the question given to us. So intervention means intervene, so it's an attempt to intervene, the usual sequence of development of disease. So don't forget the word sequence. Here you will have to write 4 modes: health promotion, specific protection, try to recollect, early diagnosis and treatment, disability limitation and rehabilitation. I didn't show you so that you can recollect. And in this video we have mainly focused on health promotion. Under health promotion there are 4 points: health and education, environment modification, nutritional intervention and lifestyle and behavioral changes. Under the first health promotion, you are going to the introduction, you are going to say that you are going to improve health, okay, by enabling people to probably understand the epidemiology of the disease, strengthen the host, and this is not directed against any specific disease. Here you are going to explain the Ottawa Charter for Health Promotion, the diagram, what and all are the main points here, the main key areas: public health policy, supportive environment, community action, skill development, and reorientation of health services. I'll just write it here for you. Public health policy, supportive environment, community action, personal skill development, reorient health services. Okay. So coming to the main 4 points under health promotion, you have health education. It is very, very cost effective. It is, a lot of diseases can be prevented, or some of them may be requiring very little medical intervention if precaution is taken and initial first aid kind of thing has been done correctly. You can target here the public, the health providers, community leaders, decision makers also. Example for this is diarrhea ORS powder. Coming to the second point, you have environmental modifications. Here you will mention air, water, sanitary latrines, control of insects, rodents, housing, and all these are non-clinical and they have been very successful in preventing diseases. Nutritional intervention, we talk about food nutrition, diet, and you will talk about the distribution of food, fortification of food, child feeding programs. You can talk about Anganwadis, and you can also talk about pregnant mothers receiving healthy food, nutritional food, you can say. Now coming to lifestyle and behavioral changes, it's the responsibility of individual, community, physician and health workers, and the interventions will have to be at an organizational level, political level, social and economic levels. Examples, you can give smoking, alcohol, and here you should remember that you should set the goals and you should have a target group for this. Fine. Meet us in the next video to learn about specific protection, early diagnosis and treatment, disability limitation and rehabilitation.